I'd like to welcome everyone again to the Merge Medical Podcast. I'm Dr. Jeff Brown with my co-host, Dr. Jeff Cole. I am joined today by Ronak Vyas and Dr. Greg Goldmacher. They are the co-founders of MedCoShare. In very simple terms, rents office space to allied health professionals, but there's a lot more to it than that. Guys, welcome. Welcome to Merge Medical.
Thanks for having us.
Thank you.
Greg, you want to start us off with a brief description of how MedCoShare is different than just time-sharing medical office space?
Sure. I mean, so the core problem we're trying to solve, of course, is the fact that what physicians and healthcare providers more broadly want in their life is flexibility and autonomy. And one of the biggest obstacles to that is just having space to practice. So if you want to be on your own, but you want to be able to see patients part-time or see patients in multiple locations, that's not really possible with traditional medical leasing. And Jeff, as you point out, this is kind of basically just a space sharing concept. However, beyond just, getting exam rooms and medical waste removal and those kind of basic services, we want to make it a more full service approach. So we've started by providing additional premium support services. So staffing for the office, medical assistants, admins, and practice marketing services, digital websites, social media, as well as a community that essentially functions as equivalent to an internal referral network where providers can help each other grow, develop, and also support each other through kind of practicing in this innovative setting.
I think you guys plan to move toward other solutions such as EMR and group purchasing, revenue cycle management, things of that nature. Is that tied to this next raise that you're planning?
It is, yeah. And we've been very strategic about what we launch, and it's based on the feedback of our current members. So we do surveys every year. And we have a little under 50 members right now within our 3 locations. And then we ask, what's your biggest problems? What can we do to help not only solve some of your headaches, but also for you to grow your practice? So it started with marketing and staffing. But as we grow and as their practices grow as well, we want to add additional services like you just mentioned.
Yeah, practice management and also, for example, things like getting credentialed, if people want to launch their practice again, and the services like that can help doctors just walk in and start seeing patients as much as possible.
Tell us about you guys briefly, your background, Ronak and Dr. Goldmacher.
Sure. So I come from a commercial real estate background where I was a broker of record, but then I also invested in properties. And as I was doing this in Philadelphia, I noticed this trend of co-working spaces that was just becoming more and more popular throughout the US. And as I was looking into it, I noticed there weren't any medical co-working spaces in the Philadelphia region. I saw a few on the West Coast and in New York, but really I felt like this was a much bigger opportunity that people weren't capitalizing on. So, after graduating from Temple MBA, where I went to school with Greg, I took this idea to him, and I figured I have the real estate sort of knowledge, but I don't have the medical expertise, right? I don't have that clinical background. So I took it to him to see, what kind of pain points or what kind of roadblocks we would have to go through to be able to launch.
Like you're beyond. I'm sorry. I feel like you're beyond proof of concept. As far as, from your initial launch, do you feel like it's been a straight line? Have you had to go back to the drawing board on any particular facets of what you're doing?
No, it's been a complete roller coaster, quite honestly, and we weren't expecting a straight line either. I've been an entrepreneur before, so I know this thing ebbs and flows, but one of the things that really hurt us, which nobody really planned for, was the pandemic. So we signed our first lease in January 2020. And then, as you know, March 2020, everything was shut down. So essentially, the first year, we couldn't do anything. We had a tough time just keeping the doors open because of all the regulations that were happening in the state. But fortunately, we were able to, ride that out. And then afterwards, as soon as people were able to get vaccinated, there was a huge surplus people that wanted to join, not only from the doctor's perspective of, if they were furloughed or they were burned out in a hospital setting, but also there was a backlog of patients that wanted to get out and be seen, and especially, elective procedures, which was put on hold. There was a huge demand for that as well.
So I guess to round that out, just to put some numbers on it, so we opened our first location, and that took 14 months from opening to breaking even on a cash flow basis. The second location took 8 months. That was Marlton. The third location we opened just last year in King of Prussia, and it's thriving. And the growth is accelerating. So the trajectory hasn't exactly been linear, but I'm hoping it's the upward break of a sigmoidal.
So I think if you are really looking toward a national presence, the next step is to spread out. And the question is, where you put your dollars, whether it's raised capital or revenue. It just seems like grabbing the footprint is pretty key. Versus, I think the bolt-on medical services are important as well, but it just seems like you're at that point where really trying to expand the footprint would be critical.
Yeah, I think we set the right foundation, and we spent a lot of time creating playbooks to be able to take our model in Philadelphia and put it anywhere else in the country. And obviously there's different nuances to every region that you go to. But the goal is to go national with those, playbooks in mind, and be able to serve, markets that are really growing rapidly and they could be underserved from a medical's perspective, or even from an elective procedure perspective as well. And we've identified a few states and different regions where we can go to, where we think we would be really successful, and based on just the metrics we've seen in Philadelphia.
And can you describe briefly, if a physician, nurse practitioner wants to work with MedCoShare, how do you arrive at what their a lease fee or their agreement fee would be with MedCoShare?
So it's a membership model. So, the first thing they do is, visit our facilities and tour and see what, if this meets their needs. But as far as fees, there's a cost for a room. And there's a cost for a full-time room, and you get discount. So you can rent rooms anywhere from half day a week to full time, and one room or multiple rooms, and month to month, or for longer lease terms. And the pricing structure basically gives you, so it costs a little bit less on a per, square foot basis to go. So you get a discount for getting more days a week. You get a discount for a longer term. You get a discount for more rooms.
I see. What's the shortest term that one could use?
A month. 1 month, a half day a week. That's sort of the minimal. The start, what we call the starter package, is a half day a week.
And then, like Jeff was saying, the bolt-on sort of services, those are additive.
Those are additive, right? So the basic services like the waste removal, Wi-Fi, all kind of basic utilities, that's included in the basic membership. But then medical staffing, practice marketing, and those are additional services. And that lets practices pay only for what they need, only for what they want.
Exactly.
Just as with the space, same with the services.
I keep coming back to this in my head. We're scheduled to do a podcast with a company called Vital Health. Have you seen their name?
I'm not familiar with them.
Brittany Buss, she's in California. I just felt so what they're building is really a lot of those bolt-on pieces. And I just wonder, at least earlier in your growth stage, while you're expanding your footprint, if you partnered with a company like that had those other services, that wouldn't make really good sense. Again,
no, that's a great point. And we've started, partnering with different providers in all variety of services, just because the more we can help the doctors start their practice and grow their practice, the more incentivized they are to stay with us. But also that stickiness factor is going to be there with the different services that we provide.
Yeah, and I talked to a guy yesterday that's doing direct primary care, and this is a fascinating model. So he's got 6,500 members, is growing like crazy. We've podcast so many people. I wish we could just get all of you guys in a room. I mean, such brilliant minds like you guys that are making things better for patients and physicians, where we could just have this monster entity that could solve so many problems. Right, Jeff?
Yeah. I mean, I think and sometimes it's not possible, but if you really aren't competing at the moment with someone else doing something that you would like to offer, it could be part of your growth strategy. For sure.
We're certainly open to partnerships of all kinds.
What about competition? Who else is trying this, and how would you say to an investor that you're different and we should invest in MedCoShare rather than them?
So there are a few other small companies doing this. None of them are national at this point. There's a company in California, Arizona, New York, Florida, Texas. So the difference is most of them are either healthcare providers who are just sharing, providing some shared space in their offices, or they're real estate operators who don't really understand healthcare. So we've got a combination team of people who are experts in real estate, like Ronak and our other partners, Amit, Anthony, and healthcare providers, myself, and other colleagues, and some of our actually early investors who are clients who are also investors. So we bring together the real estate and the healthcare experience. And then in addition to, and I think that premium services side and our growth strategy, I think differentiates us from the other companies of this type.
Plus you have the expensive WeWork experiment to look at and not recreate, right?
Yes. It's learn from the mistakes of others.
Yep.
So Ronak, we do a couple of different things at Merge Medical. This is going to provide exposure to allied health professionals, potential users of MedCoShare, but we also provide this as an investment opportunity. You do have a current fundraise. Tell me about the fundraise and how you arrive at your valuation.
Yeah, absolutely. So we have an active fundraise going on right now. We're looking to raise $2 million out of $15 million pre-money valuation. The way we came up with the valuation is through our current revenue, as well as the growth projections. And then we also looked at other companies that were raising and what valuation that they were raising at. So a combination of, all three things. And it's not a perfect science, but we feel comfortable, with that valuation, as well as when we look to do 2 million, we broke it down as to what it would be used for. And, we need to do a combination of growing out the services as well as increasing our retail presence. And most likely we're going to start entering other markets. So, right now we're based in the Northeast, and we're going to grow up and down the 95 corridor, but we're also looking into other states that really don't have any sort of competition, or they might just have one location, one other competitor in the space.
I think private market investors understand that patience is key. For a lot of investments, it's really that merger, that sell, that M&A activity. Is there anything short of that you guys might offer? Like if you become wildly successful, could there be a dividend, or what do you foresee there?
I mean, at the moment, we're reinvesting everything into the business. Thinking about exit strategies down the line, I mean, there's lots of opportunities. The important thing for us is to grow and to get as many clients and through them serve as many patients as possible. How this gets monetized in an exit, I mean, there's lots of possibilities out there.
And regarding dividends, everything is possible. We want to do what's best for the investors as well.
And for clarification, you have currently 3 locations, 50 members total?
A little under 50, yep.
50. And what do you plan to do in 24? What's solid? What's a hopeful?
Sure. So we're looking to open 2 to 3 more locations, and then also add more services. Right now we have staffing and marketing, and we're looking to add a few more things as well. And then those locations, they may not be local. So we might enter other states. And if that happens, we're really on course to be the largest medical co-working operator in the country.
And I want to make sure we get in the 10 for 10 that you guys ultimately see this being a turnkey, not just office rent space, but a turnkey model where a clinician can come in. You guys are going to assist with the billing, EMR, medical record storage, everything. They just show up, do their clinical side, and you guys handle the rest. That's a long-term vision, correct? But scalable, right?
Yep, a scalable version where it's a private practice accelerator for any health and wellness practice out there.
So I'm part of a large group, around 40 member orthopedic practice. We've managed to avoid private equity. I don't think we'll ever go there unless something catastrophic happens. So we have a lot of support. We have a lot of internal talent. Are we in any way a client for yours? Because we've got a growth strategy that may include 3 different satellites at a similar timing. Or is your primary target client, a one person, 2, 3? Is that where you see your true client base?
That's it. So most of them are 1, 2, or 3, but larger practices that want a satellite are absolutely not just welcome, but happening, right? There's a derm practice where our offices are one of their satellite locations, and I don't, sometimes it's actually the dermatologist, sometimes it's their PA or NP that comes to practice there. But
yep, so we have a group of 3 ENT surgeons. And then the derm practice that Greg mentioned, they have $1 million office in downtown Center City. And they didn't want to make that same investment into South Jersey, but they knew there was a huge patient pool that was coming from that market.
Mm-hmm.
So they opened a satellite location with us, and they've done phenomenally well.
So it's not just for the individual practitioner that doesn't want to put the upfront cost, but even a practice that wants to expand and not have the upfront cost of a long-term lease or their equipment inside.
Exactly. And we're talking to large institutions that may take satellite space with us, like large hospital groups, because, for them to come in, and it's not just an issue of money. Obviously, it's costlier to buy real estate.
Mm-hmm.
It's also an issue of time. So, when you do that, you're looking at maybe a year or more to scope out the space, purchase it, renovate it, get it open, versus the turnaround time for us. I mean, we've had practitioners start in under a week, and the average is just a couple of months. So it really speeds up that timeline of opening.
Yeah, and time is money. So it's a way to expand your footprint. So for Dr. Cole's practice, if they wanted to expand into past the suburbs out into more rural areas, that'd be something that they could help with.
Exactly. Yeah, that's the ultimate vision.
Yeah, I can really see a benefit to that. Well, I love what you guys are doing. We try to do something on the podcast. It's got to check mark a few boxes. It needs to help physicians do their job. It needs to help patients, and it also at least needs to have the potential for physicians and allied healthcare professionals to enrich their lives financially. And MedCoShare definitely does that. If I could summarize, MedCoShare is a scalable, soon-to-be turnkey solution for allied health providers needing part-time or full-time clinical office space without the upfront cost of staffing or long-term leases.
That's right.
Perfect.
Dr. Goldmacher, Ronak, thanks for joining us. I'm your host, Dr. Jeff Brown, with my co-host, Dr. Jeff Cole, and this has been a great podcast on Merge Medical.
Thanks for having us.
Excellent.
Thank you. Pleasure to be here.